"O God, our help in ages past." Hopefully, it will be projected. But in our hymn books, you can check, depending on which one you have, you can check 223. If you don't find it in 223, check 286. Any of the hymn books in your possession, 223 or 286. All right, if you are there, "O God, our help in ages past." So that is the tune. You may join me. 1, 2, sing. "O God, our help in ages past, our hope for years to come, our shelter from the stormy blast, and our eternal home." 2. "Under the shadow of thy throne, still may we dwell secure. Sufficient is thine arm alone, and our defense is sure." 3. "Before the hills in order stood, all earth received her frame. From everlasting thou art God, to endless years the same." 4. "O God, our help in ages past, our hope for years to come. Be thou our guide while shall last, and our eternal home." We'll stop here for our time. That was before. It's up to 6 actually, but we'll just stop here. May God bless this hymn in our hearts in Jesus' name. All right. So yesterday we had 2 sessions. We had a session on blood donation, and we have a pool of people that are coming in today to donate blood by reason of that talk, hopefully, after this morning sessions. And then we had another session on fertility issues that was quite educative and enlightening. So we're progressing today. We'll be having 2 sessions today. The first talk will be on diseases of the liver, the heart, and the kidney. And that is going to be taken by one of us. He's a gastroenterologist in the Jos University Teaching Hospital. I'll call his name when I tell you the second talk. The second talk today will be on mental health. It's going to be on mental health and rest. And this topic is apt, considering the times we all find ourselves, and we believe that we would all benefit from that talk. So the first talk on diseases of the liver, the heart, and the kidneys is going to be taken by Dr. PANTONG DAVWAR, a gastroenterologist with the Jos University Teaching Hospital. Please put your hands together as I call him up. Welcome, sir.
I greet you all in the name of our Lord Jesus. I thank God for this opportunity I have to have this conversation with us this morning. It's not the kind of topic I usually discuss. This is where Ferdinand is expert, prevention of diseases. We treat when the disease has already happened. But it's very important to talk about prevention of diseases of the heart, the liver, and the kidney, because these are vital organs. When I say vital organs, they are the important organs in the body. Let us pray. Heavenly Father, thank you so much for this opportunity that you've given to us as a church to have these conversations around our health, knowing that our body is your temple. We pray that you give us wisdom as we discuss this and help us to understand and take the necessary action that is required of us as Christians to take care of this body that you have given to us in order for us to be able to bring glory to your name at the end of the day. In Jesus' name we pray. Amen. Yeah. So what's the plan? They move the slides for me? Okay. Right. This looks really, really small, but I was preparing on my computer. I didn't know that I was going to have very tiny fonts like this. But basically, these are the organs that we're going to be talking about. Interestingly, this morning I was reviewing the slides and my son came in and says, "What is this, Daddy? This looks like a beans." When he was referring to the kidney. I said, "Alan, this is not beans. This is your kidney. This is what it looks like." So I hope there are people, no people here who are saying, "Is this a beans or not?" Yeah, so the one you see on the far left there is the heart. In the middle is the liver. And to the far left is the kidney. Right, so these are among the vital organs we have. The other ones that we did not put here, it's the brain, basically. But these are the main vital organs that we have in our body. Can I have the next slide? And most of the discussion we are going to be having today will be centered around these organs. And interestingly, I find that, next slide. No, back. Okay, so interestingly, I find that some of my patients don't know where their liver is. So they keep complaining. They say, "Oh, I've been told I have hepatitis and I'm having a lot of pain here." But because they've been told they have hepatitis, they are really, really worried. So this pain they're having here, they're really thinking their liver is gone. And I say, "Oh, no, but that's not where the liver is. The liver is located on this side." And they're like, "Oh, okay. I actually thought that's my liver that was paining me." But it's actually not. So I thought it would be good for us to know where these organs are. So the liver is located right here. Right? So when you put your hand here, you're actually putting your hands on your liver, basically. Right? On the right side. Yeah, on the right side. Right side. So if you place your hand on the right side, you're actually putting your hands on where your liver is. And if you do this, you're placing your hands on your kidneys. So that's where your kidneys are located. Right there, okay? Yeah, so you know when you are sick and you go to the doctor, he says, "Where are you feeling the pain?" He says, "I want to know." It's because we know where the organs are, and it helps us to sort of say what the problem might be. And then the heart. The heart is located right here. This one everybody knows because, you know, love matters, isn't it? Yeah, so everybody knows where the heart is. So these are the locations of these organs. Can I have the next slide? So when we say prevention is better than cure, this is a very common adage. What do we really mean by prevention is better than cure? We mean that it is better you stop an event from happening than allowing it to happen and then you want to treat. Okay? A very, very good example is, I see that there are a lot of adults in the congregation. Your car, right? There are a certain group of people that always take their car for servicing, isn't it? Every 3 months, on Saturday, they take their car for servicing because they are preventing something from happening. There's another group that until the car stops before they will call the mechanic. So those people are the common ones that you see by the roadside. There was an evening I stopped to do my usual activity and Ferdinand stopped. He says, "Oh, I thought your car spoiled." I said, no, it has not spoiled. So there's this group of people that even though they've heard the sound, the car is making noise. It's telling them that something is wrong. They are not yet ready to go to the mechanic until they kick the car and it doesn't start. Then they say, So this is an analogy of what a lot of us do, right? Our body requires servicing. Our body requires us to, every now and then, have it checked. Even when we don't feel sick, right? Even when we don't feel sick, our body wants us to go to the hospital and get checked. I have a lot of patients that pride themselves in the fact that I have really, really never been sick and I've never really gone to the hospital. I say, you are the people that are reducing our salary, eh? But that I meant as a joke. But really, it's not something to be proud of that I have never been, in the past 5 years, I have not been to the hospital. It is foolishness. Okay? It's not a wise thing to say, in the past 10 I have my health. As if it's fate, right? You have to have your body checked, right? Because from the moment you are giving birth to, the biological clock starts ticking. cells start dying, wear and tear starts happening. You know, no matter how careful you are, whatever new thing you buy, as you use it every day, we use these our organs every day. In fact, the heart, the moment the child is not even the moment a child is conceived, within 3 weeks the heart starts beating. Eh? So I can see some gray-haired people in the congregation. Auntie Biola, for the past 70 years, ting, 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 every minute, every second. It will get tired now. So every moment, these organs are active. They are doing something. So they are experiencing wear and tear. And you need to go and patch them. You need to go and put some grease. You need to go and polish. You know, it's like your shoe. Every day you're wearing your shoe and you don't carry polish and renew it. It wears off, isn't it? So that's what we mean by prevention is better than cure. As simple as that sounds, people don't do it. People don't do it. Can I have the next slide? Next slide. Yeah, the next slide after this, prevention is better than cure. Yeah, and really, I sometimes don't blame people when they find prevention to be very difficult. It's because we are feeling healthy. And mostly in Christendom, we really have, maybe perhaps not in Equa, but most of the Orthodox churches, it's seen as lack of faith when you fall sick and go to the hospital. If you just generally want to have a health check, it's considered as kai. This brother, your faith is reducing. But it's not really true. Okay, it's not really true. Thank you. So if I move it here, it works. Yeah, so in terms of cost effectiveness, there's a patient I had lately that did a health checkup, and we discovered a cancer very early and did a very minor procedure for him, and we told him that, oh, your cancer is cured. He says, no, we're lying. This cancer cannot be cured like this. He has heard about cancer and how, it's you have to have chemotherapy, you have to have radiotherapy, and most people die. And we were telling him that this thing that we just went and did 30 minutes has cured him. I said, yes, it's because you did a screening test, and we discovered this when the cancer had not gone anywhere. It was just a very tiny bud inside your colon, and we took it out completely, right? So, but this is because this patient was able to afford 120,000 to do a wide range of tests. Even though he wasn't feeling sick, he could afford to do that. So even though getting 120,000 to do a wide range of tests looks like a large sum of money, but if you compare that to someone who has a colon cancer and the amount of money he's going to spend, not even the money, but the fact that the quality of life is significantly reduced and the potential that that life is going to be gone. I don't know if there's anyone here who can quantify the value of life. If you've lost a loved one, then you would know. You would want to give everything and more to get that person back. So there's no quantification for the value of life. Okay? Right. So in terms of prevention always wins. There's this interesting story about the great stink. I know that quite a number of people in church travel a lot, and quite a number have been to England or have seen pictures of England. In years past, about 1858, there is a very popular river in England that is called the River of the Thames River, which is a popular tourist destination now. At every time, if you go there, there is some tourists there having some tourist activity. But that has not always been the case. Many, many years ago, that was like a sewage disposal in England. The whole a city would pour the refuse, the sewage from their bathrooms, this stuff they wash from the kitchen. The toilets were emptied into that river. And over time, the whole of London became so foul-smelling that it was called the Great Stink. But over time, and that was a very, very big problem, all right? And because of that, there was a horrific stench all over the city, and which was consequences. And an action was required to be done by someone. Someone looked at it and realized that, look, this is a problem. We cannot continue to live in a community. And as I read this story, I couldn't help but think about our city, Jos, and how dirty it has become, isn't it? And I wonder that, I think it was Auntie Comfort, that Daniam, that said, when we were talking about how dirty our city is, and she says, if you go to the villages are not as dirty as the city is. It's not really in our culture to be dirty. So we really, really don't know what exactly is happening, why the city has become really, really dirty like this. But it is people that will make the difference. It is people like you and I who are going to complain, who are going to talk, who are going to take action to make a difference. As long as we keep quiet, nothing is going to happen. So someone here, an engineer called Joseph Bazalgette, designed a new sewage system where the refuse, the feces that people pass, is collected into sewage disposal systems, right? And that's the origin of the history of our sewage disposal. But that prevented, after there was an outbreak of cholera and a lot of diseases. And you know what cholera is, isn't it? It's a very severe disease that causes people to lose water out of the body. It's a leading cause of death. There was an outbreak in Bauchi a couple of years, and people were dying like flies. Cholera is a disease of dirty, that's all. If you're not dirty, you won't get cholera, right? So this method is what we're going to use to look at these preventive methods that I'm going to be discussing today. The fact that there is a problem, and these problems have consequences, and because there are consequences, we have to prevent. If otherwise, we're not going to be able to be successful. So what is the problem? What is the problem? The problem is the fact that as human beings, right, the fact that we've been given birth to and we are living every day, we will continue to have. Okay, right, so I can freely move around. Yes, I like moving around a little. So what exactly is the problem? The problem is the fact that as human beings, our body is on a biological clock, a timer, and our system continues to deteriorate gradually, whether we like it or not. So that is the problem, okay? And these organs that we're looking at, the heart, right? The heart, the kidneys, and the liver. There are myriads of problems that can affect the heart. I have a list of 15 causes of diseases that can affect the liver, the heart. This is just the heart. I know that a lot of you just know that there's hypertension and heart failure, isn't it? But there are a lot more diseases that can affect the heart. For instance, look, every part of the heart can be affected. This one that I wrote here, very complex. I know that they all look very difficult, but coronary artery disease simply means disease of the blood vessels of the heart. And that is a very, very big problem in the Western world, right? And it is gradually becoming our problem because our diet has changed. We're now enjoying Indomie, spaghetti, Polish rice, all the nice things. And interestingly, this, the food, when we get to talk about the different types of food, you see that the food that is really sweet is the one that actually has problem. Is the one that causes the most problem that we face. So, angina pectoris is just pain because of lack of blood supply to the heart. Myocardial infarction, that's the one we call heart attack. They say, the man was okay. Well, in fact, we were even in church together with him, and he slumped and died. And that is the one that is called myocardial infarction, and it's called heart failure. Right? The other is called heart failure, when the heart fails to do its work. Now, then there are other diseases that affect the muscles of the heart itself. There are those diseases that affect the ability of the heart to contract and relax. That lop, dop that you hear. If you run, you feel your heart beating, boom, boom, boom. That beating, it's as a result of the contraction of the muscle. So there are certain diseases that affect the muscles of the heart and they don't allow it to contract as it ought to. Then there are also diseases that affect the valves of the heart, right? So the valves are just the opening, like the tap of the heart, where it opens and allows blood to enter our body. It closes to make sure that the blood does the job before coming back to the heart. So those valves can be affected. So indeed, there is a problem, okay? About these 15 are just a tip of the iceberg. There are a lot more. There are over 50 or 60 diseases that can affect the heart, probably 70 different diseases that can affect the heart. So it's not just hypertension or heart failure. There are many, many more diseases. So there's problem. And just the fact that you're coming to church and you have faith doesn't mean that you will not have one of these problems. No, you can have this problem. You may actually have one of these problems, okay? So that's why it's important for us to take into cognizance that there is this problem, all right? The other fact is the fact that the liver also has its own issues. I am a liver specialist and I see a lot of these cases. Actually, on this list of 15 cases, there is none that I have not seen. There is none that I have not seen among patients, right? So fatty liver is becoming a really, really, really big problem. It is because it's associated with obesity. People are chopping well these days, balance brought forward and all these nice things. They all make the liver to have a lot of fat. Then there is hepatitis. A lot of people think that the only problem that affects the liver is hepatitis. No, there are a lot more. You can see all that I have: liver cancer, autoimmune hepatitis, alcoholic liver disease. Alcoholic liver disease. I know that this is church and we shouldn't be talking about alcoholic liver disease, but it is a problem in church. It is a problem. A long time ago, as a medical student, I was clerking a pastor, and I didn't ask about alcohol because, he's a reverend, isn't it? Why should he drink alcohol? And apparently, this man has been drinking a lot of alcohol, and the problem he has is as a result of alcohol intake. And when I presented to my consultant, I said, no history of alcohol intake. And they said, what? They said, did you ask? I said, yes. And that was a lie. I didn't ask because, this is a pastor. Why would he drink alcohol? And they turned around and asked the old man. They said, do you drink alcohol? He says, yes. You can imagine what happened to me that day, isn't it? But I learned that it doesn't matter who it is. If you're in front of me as you came to see a doctor, I'm going to ask you, do you drink alcohol? Do you smoke? Do you have more than one wife? Okay? It doesn't matter if it is. But it's important that we discuss these things because it's becoming a problem in church. It's becoming a big problem in church. And then there's acute liver failure. So you can see that indeed there is a problem, isn't it? There is a problem. There are a lot of issues. There are a lot of issues that you have no idea about, and they can affect you. They can affect you. The fact that you are a human being like myself, you can be affected. Similarly, the kidney also has its own plethora of problems. You can see I've put 15, 15, 15. That gives us a total of 45 diseases, just tip of the iceberg. Because if you see our textbook, they are not small books now. They are like this, all of them, isn't it? Yeah, so there are a lot of problems. Life is fraught with a lot of these issues. So the kidneys can have chronic kidney disease. This is the one where you see people requiring dialysis all the time. There are infections that can affect the kidney. There are problems with the prostate of people causing the kidney not to function very well. There's cancer that can affect the kidney. There's what we call polycystic kidney, where the kidney just keeps developing something like water around it, So many diseases. So indeed, there is a problem, okay? There is a problem. And what is the consequences of all this problem? Is the fact that globally, all over the world, the number of people that die from cardiovascular disease each year has a staggering statistic of 17.9 million people dying annually from cardiovascular disease. Cardiovascular disease means diseases that affect the heart. To bring it to context is that, can you imagine every single person living in Plateau State dying in 1 year? Can you conceptualize that figure? Yeah, and the number of people that live in Plateau State is just about 3.4 million. That's Plateau State, including Jos and Shandam and Kwangpan. Imagine that from January to December, everybody in Plateau State dies. That's how big the problem is, isn't it? When you come to talking about cardiovascular disease, even bigger because we're talking of 17.9 million people. So these diseases, they happen, they are affecting people. Okay, when we're here, we will not know. But if you just drive the next 5 or 7 minutes and go to Jute, this list of diseases that I just talked about, you are going to find more than half of them on the ward. Human beings like you and I. Okay, but because you're here, you're out here, you may not really know that these things are happening. So that is why it's very important. This issue of prevention that we're going to be talking about, it's really, really important because it's a real deal. It's a big issue, isn't it? It says that cardiovascular diseases are the leading causes of death in humans. This is the World Health Organization saying so. Consequences of this problem is the fact that over 500 million people. You know that Nigeria is the most populous black nation, isn't it? Can you imagine the whole population of Nigeria, which we estimate to be 200 million, isn't it? We're saying that over 500 million people on earth are affected by hepatitis and liver-related diseases, right? Alcohol-related deaths in the United States, 140,000 annually. 140,000, okay? Yeah, how many are we in church usually? 1,000 or thereabout. So imagine within 1 year, everybody in Plateau Church. So these are problems. They are huge, huge problems. The same thing with chronic kidney disease. It's a big problem also. It's a big problem. Approximately 10% of the world's population affected by chronic kidney disease. You can see that here we're talking about 276 million people. Is it projected? Oh, okay, not projected. All right, so about 276 million people affected by chronic kidney disease. Deaths from chronic kidney disease, 1.2 million people die from chronic kidney disease annually. I'm not giving you these statistics just to scare you. I'm not giving you these statistics just to scare you. Right, can I have the next slide? Yes. So what must I do? Is the question that Nicodemus asked the Lord, right? What must I do? Because you must ask yourself, what must I do? Having seen that, that there is a problem. These problems have what? Consequences. And that you're not immune. You're not excluded from these consequences that happen when you have this disease. You must take prevention and of disease and taking care of your body very important. It should be a top priority, right? So there are levels of prevention. There are 3 levels of prevention of disease. We call it primary, secondary, and tertiary. So just like primary school, secondary school, and university. So there are 3 levels of prevention. So in terms of primary prevention, you prevent the disease from affecting you in the first place. So we're going to discuss this in little detail for the 3 organs that we're looking at this morning. So primary prevention, preventing the disease from happening in the first place, right? Secondary prevention, right? This one is preventing the disease from progressing. So you already have hypertension, you already have hepatitis, you already have an acute kidney injury. Your kidney has been affected. What can you do to prevent this from growing further? That is also a level of prevention. Okay, because, I already have it. Today we're going to have a lot of tests. If you discover that you have hypertension or hepatitis or that your PSA, your prostate is affected, does that mean that all hope is lost? Does it mean that you're going to die? There are measures that you can take to prevent the disease from progressing. There are people who have been hypertensive for the past 30 years, diabetic for the past 20 years, have many chronic diseases that they've been managing for a long period of time. So that's the level of prevention that we're also going to be looking at. And then there's tertiary prevention. This is called softening. You want to soften the impact of the disease. And that is also very, very important. You want to soften the impact of the disease on the individual. Because a lot of us have certain chronic diseases, but because we do not have information, we do not ask the right question because we lack information, we get more complications happening to us. So at this level of tertiary prevention, we're going to be talking about what are the things that will soften this impact of the disease on our lives. For instance, a person who is diabetic, do you know that you need to have regular eye checks, so that if retinopathy is discovered, that is damage to the blood vessels of the eye, something can be done about it. So in terms of primary prevention of cardiovascular disease, primary prevention of diseases of the heart, it's important for us to know here that diet is important. There's this popular adage that has become very popular these days. It says, you are what you eat. You are what you eat. You are what you eat. So you will notice that healthy diet runs across everything we're going to be talking about today, from primary to secondary prevention to tertiary presentation. So what we eat matters. What you eat, what matters. And what are the things that you can eat to prevent your heart from having a problem? There's something that we call Mediterranean diet. Mediterranean diet is excellent. Mediterranean diet is low in saturated fats. Low in saturated fats, absent of added sugar and processed foods. So natural containing food. You can see that foods that are high in saturated fats are the food that we like to eat. They are the best kind of food. The cheese, the chips. When you fry, between cooked potato and fried and chips, which is sweeter? Chips. In fact, yesterday night I took chips, even though I was preparing for this presentation. Yeah, but it's very important for us to know that as we eat these saturated food that are rich in fats, they affect us. But it's as a result of demographic transition, the fact that we are acquiring a culture that is alien to us. Before, I would have probably eaten tuwo and karkashi in the evening yesterday, isn't it? And the tuwo is not going to be semovita. It would have been grinded maize, isn't it? But I don't think I can remember seeing grinded maize in my house in a long time. And if you ask yourself the same question, so this message is not just to you, it's also to me, isn't it? That if you check your store, it's very unlikely that you have the right kind of food, basically. There will be spaghetti there. There's going to be semovita that has been dehusked. The rice is not brown rice. It is foreign rice that has been polished, So the type of food we eat matters. But the emphasis is on fruits, vegetable, whole grains, and lean protein sources. So this is typically the life of the village man they're asking us to adapt. Is it so difficult for us to basically do those things that we were doing when it was life in the village? And as simple as these things we're talking about, they make a whole lot of difference. They make white cousins, salt and sugar. Yeah, white cousins. Very dangerous substances. But they have become so important in our daily life, it's almost like you cannot do without it. Have you ever tried not eating breakfast and then trying to get something to eat outside? It's very unlikely that you're going to get something that doesn't have sugar. If you just want to quickly grab something, you're hungry. Very unlikely. It's going to be much more difficult. You need to take 30 to 40 steps to get something that doesn't have sugar, and just one step to get something that you can eat that has sugar in it. Right? So that is how we gradually we are poisoning our body, because you see, it's easy. Bad things are very easy to do. Anything that you find extremely easy to do has consequences attached to it. And literally that's what you see here. We quickly leave food because food is a very big topic, but emphasis is on fruits and vegetables, whole grain and lean protein. And there are lots and tons of examples. And we're lucky to be in Jos. We have lots of fruits and vegetables, and it should be an integral part of our food, our everyday food. Why is this thing called the Mediterranean diet, and what is the concept? The concept is the fact that the people that live in the Mediterranean region, they have a lot of fruits, they have a lot of vegetables, and they have the sea by their side. So they take fish as their source of protein. And when studies were done, it was discovered that those people hardly had any cardiovascular disease, any heart disease at all. So this has become a standard recommendation all over the world. Fruits, vegetable, fish, lean protein. Food, what? Fruits, vegetables, and fish. Now, regular exercise. This is also another very important thing. And I want us to understand that there's a difference between exercise and walk. So Auntie Biola can gardening, she loves gardening, isn't it, Auntie? Gardening is a hobby for her. So when she gardens, that is exercise. Okay? Perhaps Joshua, he is a gardener. That is his job. When he is gardening, he is what? Walking. He is not exercising. And those two are different. Because I see many people say, oh, but at my walk, I go up and down and do this thing. You are what? Walking. When you are exercising, it is what? Enjoyment. The way the body is extremely complex. It understands. When you are walking, the body tells it that what? Your mind tells your body that you are what? Walking. The type of hormones that your body produces is walk hormones. When you are exercising, your body tells your mind tells your body that you are what? Exercising and relaxing. The type of hormones that are produced are different. Yes, so it doesn't matter whether you're a farmer, you are going to a farm. Yeah, if it's not considered to be a hobby by you, and you can't lie to yourself, Yes, you can't lie to yourself. You know whether this is work or this is a hobby. If it is a hobby, it is exercise. If you have a person who carries one bag of cement from here and takes it to the gate, he is walking. right? He's doing exercise, he's carrying, but that is not considered to be exercise, because when you exercise, the benefit you get is from the activity and the type of hormones that are produced by the body, right? So when you undergo through work, your body is producing stress hormones to make you to cope with that exercise that you're doing, and that has its damaging effect. Whereas when you're exercising, your body produces happiness hormones. That's why if you go jogging and you come back, or you take a 30-minute walk and you sweat and you come back, there's that feeling of satisfaction, of happiness. It's because of the type of hormones that the body produces. So we are advised to exercise regularly. Smoking cessation, I say this is church, we shouldn't be talking about smoking, but it's important because people smoke. Some of our husbands smoke, some of the wives smoke, some of our children smoke. And so smoking cessation. Smoking cessation is considered to be the single most important lifestyle change that stops disease from progressing. Smoking cessation. So if you're not smoking, pat yourself on the back, because you are really, really helping yourself in terms of preventing cardiovascular disease. Weight management, weight loss. A lot of patients tell me that, our own is genetical. It is in this family. It is in this family. I cannot do anything about it. But that's not true. Have you ever seen a fat Somalian? Exactly. You will hardly see somebody from Somalia. Yeah, especially if you look at the pictures that you see, or if you even meet them, right? Because there is a lot of food scarcity. So we gain weight simply because we do not burn the exact amount of food that we take. Simple as that. If you burn the exact amount of food intake, if you are able to really, really burn that quantity that you take, there's no how you're going to get weight, even if it's family. Everybody in your family is fat. No, right? It's just a simple principle, basically. That's what it is. So we have to modify our diet. So it's connected to diet also. And then there's blood pressure control, regular monitoring of blood pressure, It's very important. And right these days, there are a lot of blood pressure machines in people's homes. You can always check your blood pressure. You always have our Nigerian doctors, whether you like it or not, they are available. Yeah? You text your doctor, he replies. You call your doctor, he replies. Try seeking an appointment to see a cardiologist in the US or in the UK. Or in Israel. Almost impossible. Yes. If Auntie wants to see a neurosurgeon today, I can make it happen for her. If we were in UK, it will not be possible. So we have an advantage. Despite all that is going on, you have to look at the bright side. Our specialists are available. You can actually, it has happened many times where I know Sado and the other doctors will say, hey, just outside this church, here. You see a specialist. He will sort you out. Okay, so there's accessibility, and you can take advantage of that. And there's cholesterol management. Comes down to diet also. So food, honestly, food. Very important, the type of food that we eat. And it's very difficult to come because food is a very diverse kind of thing. The people in Makurdi eat something different, but uniformly, what it said is that to have a platform where everybody understands is to reduce the processing of the food. When you take the food as whole as it is, less processing, less sweet, but much more healthier. Then stress management, I'm not going to talk about it. I highlighted spending time in nature because that's very important, but I know that Dr. Gyang is going to hammer on stress management today. And so that you just add that to what I've been talking about as a part of primary prevention of cardiovascular disease. Because stress, what it does is that it's, those hormones that I talked about that are released when you are walking, when you are doing work. When you walk too much, you say, Kai, I'm stressed up, isn't it? Because those hormones, those stress hormones, they increase. And they cause the blood pressure to go up. They cause the heart to overwork itself. If you're running because a dog came here, your heart starts beating very fast, right? It is that hormone, that stress hormone, that makes the heart to beat very, 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 very fast, So knowing your numbers, this cannot be overemphasized. I find plenty people, many of them, they are hypertensive, they are diabetic. Have you ever checked your blood pressure? I have not to. They are afraid of checking the blood pressure. You need to know your numbers, okay? It's not lack of faith. It is part of taking care of yourself, right? It's taking care so that you are able to live, to do what God has created you for. To do what God has created you for. So you have to, it's not lack of faith when you go to check your blood pressure to say, I want to know what the numbers are. So know your numbers, because I have met a lot of young people, 40 years of age, having severe hypertension without knowing that they are hypertensive. Because they don't know their numbers. They still feel as if they are young people. Check your blood pressure. Check your blood pressure. Now, in terms of the liver, healthy weight management has come up again, all right? So you see that it is duplicating. Now, the liver is like a central organ in the body. It's very, very cardinal organ. And weight gain, if you gain excess weight, it puts an unbearable amount of pressure on the liver. In fact, obesity is one of the leading causes of liver transplant these days. Obesity, liver transplant. In fact, most of my patients who are women that have liver cancer is because of obesity and nothing else. They never took alcohol. They don't have hepatitis B. They don't have hepatitis C. But you know, they say, is it a choir mistress something? You know? A Christian mother, exactly. So generally, and I understand because mothers have given birth to us. They are in charge of the kitchen and, all these nice things happening in the kitchen. But especially women have to be attentive to their weight. You have to be attentive to your weight because the burden. In fact, I think that one day we should get an expert to talk about obesity, because what obesity is doing, when you really dive into it, you will realize that it's a big problem that requires people to be attentive to it. Then we come back to healthy diet again. I have talked about it. Limit intake of processed foods. Limit intake of processed food. It is not a luxury. It is danger. It is danger. Alcohol avoidance and abstinence. In fact, for us, alcohol is one of the greatest problems that we have with liver disease, especially on the plateau, because we have a very high prevalence of hepatitis B. When you combine, I give my patients this example all the time. I say, if you are going to farm this room and you are alone, and if you're going to farm this room and there are two of you, who will finish faster? It's the two people, right? So when you have hepatitis and you have alcohol, you have two things farming your liver, isn't it? They will finish the liver fast. So that's what is happening So alcohol avoidance is absolute abstinence. Which, by the way, we shouldn't be talking about it in church, isn't it? Because it should be a no-go area for us, isn't it? But, with this woke culture, it's become... At this age, I felt under peer pressure to drink red wine. It's not like... But because almost everybody on the table was drinking red wine. And I was like, am I okay? Isn't it? I was asking myself, but then I remembered all my patients. In fact, I didn't even remember the Bible at that time. I remembered all my patients that I have been attending to, that their liver has been ravaged by alcohol. And I said, I'm not even going to start in the first place. But alcohol abstinence cannot be overemphasized, okay? It is a leading thing that if we stop, we prevent liver disease from happening. Then there is vaccination. A lot of people have said they've been vaccinated for hepatitis B, which is encourageable, and you must be vaccinated for hepatitis B. If you've not been vaccinated, you should be vaccinated. That is a primary level of prevention. Safe medication use. That drug called Panadol, that you can easily just buy over the counter. In the Western world, that is the leading cause of liver transplant, right? I made mention of the fact that doctors and healthcare providers in Nigeria are easily accessible. Yeah, it's not difficult for you to see a professional healthcare provider in Nigeria. It's not. Okay? Do not take medications on your own. It's not small. 6 years of training is not small. And almost all the doctors that you're meeting, very few of them have 6 years of training. Most of them have 12 years of training. You cannot know medicine more than them. What did I say? You cannot know medicine more than them. The fact that last week you had fever, cough, and difficulty breathing, and you took, the doctor gave you Augmentin. Next week you have cough, fever, you go and buy Augmentin. You are cheating yourself, honestly speaking. You're cheating yourself. So that medication, those drugs, is there a pharmacy in the house? Yeah. Those drugs are called what? Poisons. Every single drug is called a what? Poison. Right? But we use it with moderation. We say the benefit of this drug today outweighs the poisonous nature of the drug. If you don't use this poison to solve this problem can take the life of this patient. Then you administer the poison to the patient to save their lives. So it's not a drug that you should, these things are not things that you should play with, honestly speaking. Very, very important. Very, very important. The same thing now we jump to primary prevention of kidney disease. You would see that it is similar, right? Healthy diet, healthy weight, staying hydrated. So that's the new thing there. You know, there are a lot of people that talk about water therapy these days, eh? I don't know about that, but it's important that you drink water all the time. When you go to urinate, when you go to pee, and you see that pee is brown and is smelling, it means you have not drank enough water that day. If you normally urinate 2 or 3 times in a day, like for now, for instance, it's quite hot now. We never used to have this kind of heat in Jos, isn't it? But we're getting there. I saw a temperature of 36 the other day. We need to drink more. Especially if you are above 50, right? More so if you are 60. Water intake makes the difference. Yesterday, one of our church members was sick in the hospital. We just kept him there. Also gave him water, drip. It's just water. They gave him 4 liters, and he called me this morning and said, "Hi, I feel great." Yeah, but he's 60-something years of age. It was just water that was lacking in the body, right? So that water is very important. So staying hydrated is very, very important. Managing of diabetes, we'll talk about that in the next a few slides. Smoking cessation, once again. It has come up again. Limit over-the-counter pain medication. Ibuprofen, Indosit, Cataflam, young ladies, menstrual cramp, Cataflam, small headache, Cataflam. I washed all the children's clothes. My mother, when we were children, on Saturday, she would come out of the house in the morning. She wouldn't go back till 8 p.m. She will walk. Then she'll say, "Kai, I'll never do this thing again." The next Saturday, she'll do exactly the same thing. So women do a lot, I understand. Women do a lot more than, it's really too much. And they take a lot of over-the-counter medications as well. Those drugs are dangerous to the kidney, especially the ones I call ibuprofen, Cataflam, Feldene. They're very common drugs, right? Sudrex. Yeah, that one that they drew a man with joint pains. Yeah. There are many patients that have kidney failure, like their kidney is not working, they need dialysis or transplant, simply because they've been taking Sudrex for joint pains for many years. It knocked off their kidney completely. So that's why we say these drugs that you're seeing, is it not ibuprofen? If you go to any pharmacy, even if it's a chemist, you'll find ibuprofen there. It's there. So as simple as it looks like, that's a drug that has the potential of killing your kidney, knocking it out completely. It will not work again. So you have to limit the use of over-the-counter medication. And then regular checkups. I've talked to you that it's not something of pride to say, I have not been to the hospital in the past 10 years. No, it's not. It is actually a disadvantage, right? Ferdinand, how am I doing with time? Fair? Okay, almost done then. Right, secondary prevention, I talk too much. That's one problem I have. So I'm going to limit it to those red things. Secondary prevention of cardiovascular disease. So the disease has already happened. You see that use of medication also very important. A lot of people, the doctor sat down and clocked you and made diagnosis. You spend money to do tests. They wrote drug for you. You take it for 2 months. You say, am I going to keep taking this drug for the rest of my life? Me, I have stopped taking it too. Continue. Cardiac rehabilitation, regular checkups. So you find this is one of the biggest problems we have. Chief, you will say, lost to follow up. Patient comes to Jude 1 month. The next, I say, come in 3 months. He comes in 3 months. Come in the next 6 months. Then he'll come back 3 years after and say, I used to be a patient. That is not the way you prevent disease from progressing. 12 years of medicine is not play, honestly speaking. It's not play. So the sort of information, the sort of things we know, if we say we're going to download it, some people say this thing will crash. It's tons of information. that you have about human beings and the way the body works. When you come to the hospital, sometimes they don't do anything, or they just look at you, write drug for you, and you go. The day that something is wrong, you enter that consulting room, everything changes. The person is going to say, no, what is this? What is that? What is that? Because as he just entered, he has already seen all he needs to see because of the training. So it's important to keep your follow-up appointment. That is part of prevention of disease from progressing, right? It's very, very important. Regular checkup. Same thing with liver disease. Regular follow-up with your doctors, regular taking of medication. I've seen patients that we've prescribed tenofovir for them. They continue to take the medicine continuously, right? Which is good. Some stop taking it completely. That is bad. Lifestyle modification, again, we talk about diet, very important. Vaccination, very important. Avoiding hepatotoxins. There are a lot of these supplements all over the place. Nigeria has very weak regulations. Be careful with those things that you're taking. GNLD, live well, some things like that. Nigeria has very weak regulations. There is a drug called securinine that I see a lot of my patients with. I don't know where they get it. If you Google that drug is an investigational chemical. It is a drug that is found over the counter in Nigeria. It's a chemical that is being investigated. You find tablets of it, anybody can buy. Only God knows what it is doing to people's bodies. Only God knows. So be very careful with all these hepatotoxic things, those poisons that people are taking. Limit yourself. Eat the cabbage instead of taking something that is inside one bottle. They say this is supplement. The cabbage is there. The carrot is there. If you don't have money to buy it, you can actually farm it in your backyard. If you don't have even your old buckets, you can farm it inside. So you actually have no excuse, really. You should eat those things regularly. And then we talk about regular monitoring of this thing. Abstinence from alcohol has come up again. Safe medication use, safe medication use, safe medication use. The drugs that we give you are dangerous drugs, so on their own. They have to be used in the context of someone who knows how to use them. Otherwise, you are cheating yourself. Okay? Follow up with physicians. Follow up with your physician. Your doctor, when he sees you, he knows what to do. The same thing with your regular monitoring of your blood pressure. The thing with the blood pressure is that when your blood pressure is high, it continues to cause damage in other organs. So you're hypertensive, the organs are being damaged, the brain is being damaged, the heart is being damaged, the kidneys are being damaged, the blood vessels are being damaged. So your blood pressure has to be constantly normal. That fallacy that says, I take my antihypertensives today, I jump one day and I take it, is you are cheating yourself. Many times when patients tell me that the moment I take their blood pressure, it's 170, 100. Did you know? No. They say it's only when I have headache that I take the medicine. You're still cheating yourself. If you've been diagnosed to be hypertensive, take your medicine every day. Go and see your doctor regularly. The day the doctor says, I'm going to take off one of these drugs, that is the day you stop taking the drugs. It's not for you to stop taking it on your own. If you look at my phone, there are countless number of messages that I'll be sending to people. Take your drug, or take your drug, because they say, I stopped the medicine because of. Because of can cause problem. So regular exercise also features here. Blood sugar control, blood pressure control, fluid management, regular monitoring of your blood pressure. Those are things that can prevent. So in terms of tertiary prevention, we'll lump it up together and talk about it. That tertiary prevention is you are reducing the trouble. You're reducing the trouble. So this person already has this problem. The disease has progressed. You want to reduce their problem. So these are very expensive things: medication, procedures, cardiac rehabilitation, lifestyle medication, and patient education. So these last two are the ones I'm going to talk about. Lifestyle modification. We have talked about it in without mincing words, that you need to modify your diet, exercise, weight management. And then patient education is also important. Where are you getting your information from? Right? A lot of us have access to Google now. There are a lot of patient websites that are patient education websites. Those are the websites you go to find information, not just random websites, because people read all sorts of things. And majority, maybe Dr. GYANG is going to talk about that later, majority of the people who come to us with a hypertension and then anxiety disorder is because of Google. Yeah, they are told they have hypertension, they Google the symptoms. Before you arrive, I've finished. 5 minutes, I'll be done. Then the same thing with tertiary prevention of liver diseases, liver transplant, dietary management, liver cancer screening. That's very important. So one of the reasons why we have this sort of things is so that you're educated, right? When you're talking with your doctor, it's an educated discussion. Hey, doctor, have I had a liver cancer screening before? He says, no, why do you want to screen? Just part of prevention. And yeah. But if he didn't say it, the doctor might not have, remember that you need that. And because doctors are humans too, right? So it's also good for you to know so you can ask your doctor. Then your doctor will say, well, you don't need this, you don't need that. But it's a conversation, and we're not monsters. Yeah, we listen to our patients. I have had patients who have said, can you do this for me? And we did it, and there was problem. And the patient got medication for it. The same thing with tertiary prevention. Patient need dialysis, patient need kidney transplant. When the doctor, you see, you are trained to save lives, not trained to kill people. I find that we make recommendations to patients about what is best for them. But they go out. If you want to do church planting, maybe you are going to meet Reverend Jerry Farouk. Are you going to come and meet Auntie Amaka? No. So when you are looking for medical advice, it's not people on the street that will tell you that surgery will kill you. No. It's the doctor that knows that you need the surgery. But we will advise patient to, then somebody, one relative will call him on the phone. Then he will follow that advice of the relative. It just doesn't make sense. When you are looking for help with your car, it's not pastor. You won't call Reverend Chomchai and say, my car has stopped on the road too. It's mechanic, Abi? You call your mechanic. So when you are sick, you don't go to people on the street. And so when you are giving advice, patient is for dialysis. We will spend 6 hours convincing the family that the patient needs dialysis. That is also cheating yourself. On hearing it, many of his disciples said, this is difficult teaching. Who can accept it? But the Bible says what? His divine power has given us everything we need for a godly life through our knowledge of him who called us by his own glory and goodness. An ounce of prevention is worth a pound of cure. Thank you very much.
Thank you so much. We'll take a few questions. So if you have a question, you may just raise your hand. If you don't mind speaking, you can do that. But if you want to write it, papers will get to you. So let me take the first person there.
Good morning, church. My name is Stella. Sir, I would like to know a little bit more about what leads to somebody wearing a pacemaker. And then when you talked about blood pressure, damaging other organs of the body, maybe I will have to meet you privately for further explanation on that. But what leads to one having to wear a pacemaker? Thank you.
Thank you. Can I see all those that have questions so we can just take them and block and he would answer? Any other?
Thank you, Pantong. Mine is not a question. Just to ask you to talk, maybe emphasize this issue of alcohol. This wokeness is becoming a problem, and many people have begun to drink. Before, when you became born again, everybody knew that you don't drink. Now people drink. In this church, people are drinking. They gather in places where they drink, and it's normal. Even when you talk nice, as if you're overdoing it or something. But now, this is even another reason not to drink. For the Bible says our bodies are the temple of the Holy Spirit. So you must take good care of it. So maybe talk to us again so that we will hear it very well. That drinking is not good for us. It's not good for us.
You can go ahead, sir. Okay, I can see one here.
Just a simple question.
Yes, sir.
You talk about alcohol. Can you give us a bit of statistics on how, when somebody who takes alcohol and somebody who takes water, how do they affect the liver in terms of processing the two? Okay. That will help people see.
Good morning, church. I don't have a question, but I want to bring out a biblical verse that says, whatever you do it like unto God. And I want to bring in this because when you said you differentiate between work and exercise, if you encourage people, even when at work, they should do it as unto God. It has to do with their mental capacity. And if they do it as unto God and they do it happily, that will also amount to work with wages and work for health. Thank you very much.
Yeah, thank you very much for those questions. So you remember when I showed the slides about the different diseases that affect the heart? There was one that was called arrhythmia there. So I said that's the one that has to do with the rhythm of the heart, with the electrical activity of the heart. So our heart is controlled by electricity, which is generated by this human body is complex, right? God is powerful indeed. Every time I read about the human body, I know that there's an awesome God out there. So the electrical activity that is being generated by the human body powers the heart. So there are certain diseases that affect this electrical activity of the body. So when the human heart has problem with the rhythm, the way the electrical activity drives the heart, the patient will need a pacemaker to help control that rhythm. So people who have a pacemaker usually have a slow heart that the pacemaker needs to wake it up. So remember I said the moment a child is 3 weeks old, the heart begins to beat, right? So the normal heart rate is between 60 beats to 100 beats. So for some people, it gets to 40, 30, 20. So once it starts going down like that, we need to put a pacemaker so that every time it starts going down, the pacemaker will like slap the heart. Then the heart will wake up and beat between 60, 70. So there are people like that have that kind of device inserted in their heart so that each time it starts forgetting that it needs to beat, the pacemaker will wake it up. So you have to, Professor Ocheke said here once when he was talking on stage about the amount of work the kidney does, we've been unaware of it, filtering 25 liters every day. So as you are sitting down here, the sort of things that are happening, your kidney filtering the water, your liver detoxifying all the toxins that you ate yesterday, all the food you ate, all the poisons that have been generated, your liver is amazing work going on in the background. So there is reason to thank God each and every day you wake up. Each and every day, because, too much. Alcohol, yeah. And I deliberately gave the example of the issue of at the age I am. I'm not too old. I'm 43 now. I felt under peer pressure. Yeah. I didn't drink, but I felt it. I almost put the glass there. Because, it's every people I know and respect, they all accepted the alcohol, the red wine, because it looked okay. So there is that pressure. You go for very big parties, you are exalted position, you go for a dining with the governor. The governor is the one that pushes the red wine to you. How do you say no? You get it? So people are under pressure to drink alcohol, whether you like it or not, regardless of the age. Young people, exceptional, even more so. Right? But alcohol, and maybe Dr. GYANG, you would also, from your perspective as an expert, also talk about this alcohol again, because they see the danger of it even more than we see in their psychiatry clinics. Alcohol is considered to be a gateway drug. Once you start drinking alcohol, it opens you up to all other forms of dangerous drugs, apart from the fact that alcohol can affect every single organ of the body. It can damage the brain to the point that people do not remember things, right? Alcohol can damage the brain. It can damage the eye. It can damage the heart, right? Probably nothing in the lungs, but it can damage the heart. It can damage the kidney. It can damage the colon and can cause cancers anywhere. So alcohol is a carcinogen, right? A carcinogen is any substance that causes cancer. Just like cigarette smoking causes lung cancer, alcohol causes liver cancer, can cause kidney cancer, can cause skin cancer. Any type of cancer actually can be caused by alcohol. And one of the problems that with alcohol is the fact that the liver is the one that metabolizes it. So as it is metabolizing the alcohol, it is being toxic to the liver. So you can't even compare it with water at all. As you drink alcohol, the liver is trying to process it for you because it does that just as it will process any other food. The alcohol is also, it's like you carry scorpion in your pocket, eh? Yeah, as you're moving around, it is stinging you. So as the liver is processing the alcohol, you took it as food. So the body will say he ate food, and it will try to process the food. But as the food is being processed, it is damaging the liver. Can you imagine that? Yeah, you're taking something that is destroying your body. So, and after it processes it, it produces, when you eat food, the liver processes it and gives you nutrient. When you drink alcohol, the body processes it, then it damages the liver. The thing that it processes is not nutrient, it's something that is dangerous that damages the heart, damages the brain, and damages your blood vessel. So it's an absolutely dangerous product. And as a church, I think it shouldn't be something, like I said, it shouldn't be something that we should be discussing in church, but it's where we find ourselves. It is happening in church. It's happening. There are patients, I can't see any of them here, from Plateau Church that are my patients. Yes, and they have they have problems with alcohol. Yes. So it's not we're not just whitewashing or polishing the thing. It's real. It's happening, even in our midst here. That's it. Thanks for your comments, sir, about the fact that whatever you do as unto the Lord. So if you're walking, everything is possible if you believe, isn't it? Everything is possible. So how often does one need to have a comprehensive checkup, and how much does it cost? So a comprehensive checkup depends on how old you are. It's an age-driven kind of thing, okay? And there are different packages for different prices because it all depends. We know that there's a problem with money, but there are some basic tests that can be done. So, and it also depends on the hospital. But we recommend that every year you have an annual checkup. Every year. Have an annual checkup every year. You can make it your birthday. As your birthday gift, I will go to the hospital. Even if you don't have money, let them check your blood pressure. Most places will check your blood pressure free. Most places will check your blood pressure free. If you come to church, you will catch doctors free. Talk to them, ask questions, say, I'm feeling like this. They will advise also. You can find doctors in the church. They'll say, I want to do a health checkup. What should I do? They will write it for you, free of charge, at no cost. So those are some of the perks of coming to church. It's benefit. So the last question says, you talked about red wine. I thought we're told that red wine is good for the heart, especially when taken with food. Yeah, so very, very, very good question. Very, very good question, right? So these are some of the things that are coating the truth, right? So you're sugar coating the truth. So people say, red wine is good for the heart. Okay, yeah, there used to be a story like that, and there were people who were proponents of it. So the thing with research is that science is not Christianity in itself, okay? And people can lie with science, Ferdinand, you know that. People can lie with data. A statistician can show you a data in the morning that's his own data that says red wine is very good for the heart. In the evening, he will come and convince you again that red wine is what? Bad for the heart. With the same data. It's just the way he analyzes it, okay? There is no such thing as red wine is good for your heart. It has been proven. It is now documented in literature. Alcohol in whatever quantity is not good. That is the truth as it is now, even based on medical knowledge. Years ago, as a medical student, I was taught that a moderate amount of red wine, a certain percentage of red wine was good for the heart. As a medical student, I was taught that. Now, we don't teach medical students that because the science has also changed. Okay, and the truth has actually come out. But moderation in itself is a problem. Moderation, they said, somebody used to argue with me that there's nowhere in the Bible that says you should not drink beer. But it says drunkards cannot get into what? Heaven. I say, how can you get drunk if you don't drink? So there's that is where it says do not drink. Because you cannot get drunk if you don't drink. There's someone with their hands up. I hope I have time for her.
Quick, please.
Sorry, I'm coming up again because, scripture says, take a little alcohol for your often stomach aches. And then growing up in the village, I remember my grandmother, she didn't know God. But when we have any stomach upset, she takes that little bottle, they call it is it kai kai or schnapps? A little glass like this small. She just fills it up, puts a teaspoon of salt or thereabout, stirs it and gives it to us, and it clears instantly. How do you explain that mystery?
Yeah, thank you very much for the boldness, yes, because it's very bold to ask such a question in church, isn't it? It's very, very bold. And it's important because people have those theologies behind, those worldviews, and they can pass it down. There's something, I may not be 100% correct with this answer, okay? Yeah, because it's a scientific question about how do I explain it. There's something we call in medicine placebo effect, okay? Placebo effect. Did you hear that if pepper enters your eye and you put salt in your mouth, the pepper will disappear? Has it worked for you? Exactly. Yeah, so we have a lot of patients that, we have faith in our mothers, okay? The mother can solve the problem. Father can solve the problem, all right? Yeah, so that's just what I think is happening in this setting, because there's no pharmacologic basis for that to take place, that abdominal pain is sorted out. There's no pharmacologic basis for that. So I would call it a placebo effect, okay? Because my daughter, till this day, every night she wakes up, most nights she wakes up to tell me she's having stomach pain. I touch the tummy and say, yeah, okay. And she goes back to sleep. So tomorrow she's going to say, daddy's touch is healing, isn't it? Yes, it's because of the faith. That is faith, actually. That's what placebo effect is. Even in the hospital, there are patients that if they don't see Dr. GYANG or they don't see Dr. Ferdinand, they will not be okay. If they see Dr. Ferdinand, that headache goes away. You understand? So that's what we call placebo. I would attribute that to it. Take a little for the sake of the stomach. I don't know if anybody wants to answer that. Take a little for the sake of the stomach. Nobody?
I think take a little for the sake of the stomach. Before Daddy would answer, let me attempt. We don't know what problem he had with the stomach. Is it the same problem you have? So he had a specific problem when he said take a little for the sake of the stomach problem. So if you can't tell us what diagnosis he had for which he told him to take, then you can't justify that you are taking for your own.
As a matter of fact, I'm not answering the question by asking question. In medicine, do you have any situation where you prescribe a little bit of alcohol as medicine to somebody? Is there something like that?
Dr. GYANG, are you aware of any situation like that? I never give anybody alcohol. I'm a liver specialist. Yeah.
Diluents or whatever is used to mix here. They use alcohol sometimes to be able to dissolve the drug and all that, but it's just small quantity. It's not anything significant that should intoxicate you, or unless you take large quantities, like people are taking. What is that cough medicine people are taking?
Codeine, yeah.
Codeine.
I mean,
take some large quantity. It's not meant to intoxicate you. It's just as a chemical to help whatever the active ingredient to melt. Very small.
Interestingly, if you eat carbohydrate, you know those times that you have bloated stomach and you belch out, a lot of those things are converted to alcohol in the body as well. The carbohydrates that we take, it can get converted to alcohol in the body, right? Yeah, but that's not a guarantee for you to take alcohol, just because when you take tuwo, part of the digestion process is that it gets converted to alcohol. Did you know that? Yes. Okay, so it's not a guarantee that because that happens in the body. Okay, so I think that that's in that context that I am going to answer that. Yeah.
Thank you very much. I think I would just want to caution us a bit about just taking one Bible verses and then, because anything you want to do, if you want to take the Bible in isolation, as in verses in isolation, you can do anything that you want to do. Now, yes, alcohol is used for so many things, even in the hospital setting. But most times, apart from maybe methylated spirit that is used to clean your wound, which is high concentration of alcohol, there is no medication that is just alcohol. Even if you see maybe they used some level of alcohol or some parts of alcohol, because chemical reactions, you have so many things. You have ethanol, you have so many other things in alcohol. Just like marijuana, and then they use some parts of marijuana to do some medication, and then they give. That does not make marijuana itself safe. That is the same thing that I think goes with alcohol. And then if we want to look at Bible verses, look at what was told to Timothy, and then look at several other places that talk about alcohol. Talking about wine is a mocker, talking about those that drink wine would have a lot of irrational decisions, which is really scientific too. You can, have scientific pathways that lead to all of that. But for me, anytime we talk about alcohol, the most helpful verse is the verse in 1 Corinthians. I've forgotten the chapter or the verse, but it says, all things are permissible, but not all things are beneficial. All things are permissible, but I will not be enslaved by anything. Anything that has the potential to enslave, run away from it, no matter how. And alcohol is one of the greatest things that enslaves. Because when you start taking alcohol, for all of us, no matter how self-controlling you think you are, it is the decision to start that is yours. What proceeds after you start taking the alcohol is totally beyond you, because it's not only about willpower. It has a lot to do with genetics. It has a lot to do with some idiosyncratic things that are going on in yourself. So you do not have the full absolute power to decide whether you will be addicted or not. What proceeds after that is beyond you. So alcohol is enslaving. Let's run away from anything that enslaves us. Thank you.
Yeah, thank you very much. I told you that we have a lot of information. If you collect what is in our brain, you can shut. Yeah, so I think if you still have more questions, probably, maybe a Bible study on that would help.
Thank you so much. Can we give him a round of applause? We are going to move straight to the next talk on mental health, which has already begun because the speaker has already started speaking. So our speaker she'll be taking us on mental health and rest, especially in the context of where we are today in our country and as a people. So our speaker is Dr. GYANG. She's a psychiatrist with the Jos University Teaching Hospital. She's very passionate about what she does, and it's a privilege for us to have her speak to us on this topic. A round of applause as she comes up, please.
Good morning, everyone. I almost feel like a member. Of this church now. So I'm grateful. I'm grateful for extending the invitation to me to come and share this morning. I want to apologize. I'm a little bit all over the place. I've had a very crazy couple of days. I've hardly had good sleep in the last 2 days, so I'm a little bit tired, so I might not be the normal Dr. GYANG that you know. But this morning, we would be trusting God to help us within the next few minutes look at rest and mental health. I will not be talking so much about mental health per se, because if I do that, then we won't talk about rest properly. And I know we all have challenges with rest. Right now, as I'm talking to you, I need plenty of rest. So we need to look at rest. So you would understand why I'm not doing too much mental health. So I would want to start by how many of us here feel well refreshed? If you know that you're very refreshed and you don't need any rest. Nobody. So we're all tired. We're living in a world that makes us tired. Everything about life is tiring. In fact, the news that we hear is tiring. For me, I have been tired. I think on Thursday, I got home around 7 p.m. and I just went straight to bed. I didn't even take my bath. And I told my husband, I said, he was trying to tell me something. I just told him, please just wait till tomorrow. I feel physically, emotionally, mentally, and spiritually exhausted. Those were my words. And I slept and woke up. Then, that was Wednesday. I slept and woke up. And then the very next day, I felt better. But immediately I got to the hospital, things scattered, and I was back to the same level I was the previous day. And that has gone on and on till today. I'm sure that's the story of many of us. But the truth of the matter is we all know we need rest. The problem is how. When we look at the issue of rest in the Bible, it's something a concept that God initiated from the very beginning. Genesis chapter 2, verse 2. And the Lord finished creating everything he was creating, and then on the seventh day, what did he do? He rested. That was the first time the concept of rest was mentioned in the Bible. However, if we look at it, we want to ask ourselves, did God truly need to rest? What did he really do that he rested? Because the Bible said he just spoke and everything happened. He spoke and everything happened. And the book of Isaiah chapter 40 verse 28 makes us to understand clearly that God does not get tired. So if he rested, he probably rested for a reason. And I think that he rested at that time to lay an example for us, to give us a principle that would help us in this life, because he is the all-knowing, he is the sovereign God, that before he created us, he knew that we are going to get exhausted. He knew that life is going to be hard. He knows that sometimes we might not have sufficient sleep. He knows that news can be stressing. He knows that the economic situation can be stressful. And so he rested, even though he did not need to rest, so that you and I can learn to rest. To rest, according to the Bible, if you look at I'm not a theologian, disclaimer, so if there is any pastor here, if I make any error, just forgive me. But the rest that was mentioned in Genesis chapter 2 was not the rest, that came just when you were tired. But it meant to cease. It meant to stop. So someone is doing something and then you cease from continuing in that thing. That is rest. Rest is not idleness, but alteration in the direction of activity. So God rested. When you look at the rest that God had on the seventh day, he did not rest from all work, but he rested from the work of creation. He ceased the work of creation. He stopped the work of creation on the seventh day. And that led to the several instructions or commands that we had in the Bible. After Genesis 2 verse 2, the next place rest was mentioned in the Bible is in the book of Exodus chapter 20 verse 11, when we were given a command to rest, and it went on and on and on. That brought the concept of what we typically call Sabbath. Now, you know that we argue. When we start arguing, some Seventh-day Adventists will say we are wrong because we are doing it on Sunday, and we are struggling to prove that it is right to do it on Sunday. But whether you do it on Saturday or Sunday, I would want us to consider the principle of Sabbath. The word came from the Hebrew word Shabbat. Shabbat is to desist or to sit still. Desist is the same thing that God did when he rested, when he ceased, when he stopped working. So to Shabbat is to desist, is to sit still. And if you're like me, sitting still is one of the hardest things. You know, if you're a very active person, some of us have very active minds. That even when we're sleeping, you know, the mind is actively working. The principle of being still is what we really lack. Let me just stop here, since we're not talking theology today, to look at why we need to rest. Holistic rest focuses on refreshing our whole self. So rest is beyond just sleep. Rest is beyond the fact that I'm just lying on my bed or I'm idly chatting with someone. But it means refreshing our whole self. And I'm sure we all are aware of the fact that God created us spirit, soul, and body. And so when we need to take holistic rest, it means that we are resting our bodies, we rest our souls, and we rest our spirits. And that is the direction that I want this talk to go today. Rest helps us to better respond to life demands. Life can be very challenging. My life has been very challenging in the last 1 week. Now, for those that cope better with the challenges that life throws at us, and whether you like it or not, we were together with the women in Miango about 2 weeks ago, and we established the fact that whether you like it or not, no matter how spiritual you are or not, in this life you would have troubles. That is what the Bible says. So for those of you that have not had challenging times, praise the Lord, but just keep living. It will catch up with you someday. It's just life. Research has shown that those that take time to rest, those that make rest a priority, when the challenges of life comes, they are better able to cope with it. So if you are a person that takes deliberate effort, that makes deliberate effort to rest, holistic rest, if you're encountered with ill health, you're most likely to navigate through it and come out with better outcomes. If you pass through economic challenges, you're most likely to navigate through it and come out stronger. If you go through grief, you're most likely to navigate through and heal well. Rest offers us a chance to step off the wheel of life, to breathe, to reorientate before stepping back on the threshold. Sorry for the spelling error there. So it helps us to breathe, recharge, and move on. That is what rest does to us. So what is mental health? I'm sure you have been taught in this church, because I know even when I'm not in this church, I know all the mental health stuff that goes in this church. So I know some of my colleagues have come and they have talked about this. So I think you know the definition of mental health, but let's look at it very briefly. It has been defined by WHO as a state in which an individual realizes his or her own potential, can cope with the normal stresses of life, work productively, and make meaningful contribution to his or her own community. And I think that this is one of the most spiritual definitions of any science thing going on. Because there are dimensions, there are things that are expected of you to be in good mental health. One is to realize your potential. You know why you're created, you know the abilities God has put in you, and you're working to maximize or to achieve those potentials that God created you for. Remember, the Bible says we are created in Christ Jesus for good works which he had planned in advance for us to do. If you don't know that thing for which you were created and you're not working to fulfill that, then you might not be said to be mentally healthy. Mentally healthy people are able to cope with the normal stresses of life, whatever it is: ill health, grief, loss, job demotion, job loss, whatever it is, economic meltdown, fuel at 710 naira per liter. All of those things are normal stresses that come with life. Mentally healthy people, even though they might have some setback, they are able to cope with that. Mentally healthy people are able to work productively. Whatever you're doing, you should see some results. So your work should be giving you some results. You should be making progress. You should be having your promotions. Your studies should be giving you results. Your market, your business should be yielding some results. If you work and work and work and you're not seeing any results, then your mental health is actually in question. And then finally, if we're mentally healthy, we make meaningful contributions to our communities, be it our families, our churches, our anguas where we live, and wherever we find ourselves. So what is the benefit of rest to mental health? Research has shown that when we rest, when we make rest a habit, when we make rest intentional, we reduce the level of stress and anxiety in us. Stress and anxiety is something that can lead to anything from forgetfulness to cancer. You can get it from stress. Rest improves our mood. I'm sure you know that when you're tired, you're irritable. Anybody that says anything, anybody that crosses you on traffic, you forget that you're a Christian, you insult them, then you feel guilty later that you have failed. That is what stress can do. When we rest, our mood is improved. It decreases blood pressure. My friend Pantong has said a lot about that. It also provides chronic pain relief. Those of you living with osteoarthritis, arthritis of here and there, back pain, neck pain, rest can actually help you to cope with the pain better. And the less pain you have, the better mental health you have. Rest actually has been found to improve our immune system. So the cells in your body that helps to fight infection, are more effective when you rest. That is why when you are stressed, you discover that you're more likely to have catarrh, cough, cold, malaria, typhoid, and things like that. All those things are heightened when you are stressed. But when you rest, you reduce the bouts of infections and then the risks of having to buy medications. And the cost of medications are crazy. I bought antibiotics for my son yesterday. 6 doses. I paid 34,000 naira. So you can, we'll do ourselves a lot of good to avoid illnesses so that we can have money to do other things. Rest improves the strength of our cardiovascular system. Exercise is good, but rest is also very good in improving the strength of our cardiovascular system. Rest helps us to have the ability to dream for the future. Remember, mental health includes the fact that we meet our potential, the things that God has created for us to achieve on this earth. And a lot of it comes when we think about it, when we reflect about it, when we dream about it. And then the ability to dream about these things is better when we inculcate the habit of rest. It improves our problem-solving skills. If you're very tired, your problem-solving skill is almost zero. I give you an example. This morning, I barely slept last night. I was on the bed thinking about how I was going to finish up my slides and to come here at 4:30 to come and give this talk. When Ferdinand called me and said, "Ma, we are about to start." And I jumped up. I couldn't find my charger. I came with all my devices half dead. In fact, all of them are dead right now. I forgot my phone. Why? Because I had not rested enough. So the coordination to get my phone, to get my charger, to get things together to come here, I couldn't put myself to that. So when we rest, our problem-solving skills are better. It provides space for fresh creativity. Very important. But with all these things that we know, I'm sure there are a lot that you can tell me, benefits of rest. With all the things we know, a lot of us are not resting, including me. We are not resting enough. Why? A lot of us are even ashamed to rest. Ashamed to just say, I am not doing anything today. Ashamed that if my pastor calls and said, come, let's go for outreach there, to say I am stressed, that will mean that I'm less spiritual. So we are so ashamed to take rest. For some of us that are mothers, we want to be Proverbs 31 from verse 1 to 31. I mean from verse 11 to 31. Verse 10 to 31. Thank you. We want to be Proverbs 31 women. And Proverbs 31 women, they wake up from 4 a.m. and they don't go to bed. And they are all over the place doing yellow and purple yarn and whatever. So we associate rest with shame. We don't want to say, I am tired, I am exhausted, I cannot keep going. And then a lot of us are guilty when we rest. You know, a lot of us are guilty to do things for ourselves that will refresh us. A lot of us feel that it's a waste of time. Souls are, you know, it's very interesting. I don't know whether I'm less spiritual, but then there are times that you hear, it's good though that we want souls to be won, you know, the kingdom of heaven. But God did not give you the job, you alone. He gave all of us. You know, and some of us are doing the thing as if it is just for us, and we wear down our bodies, we wear down our spirits, we wear down our souls, that we are not effective even in the things that we say we are doing for God. So we feel guilty. A lot of us also feel we are undeserving. It's like we are redeeming the time because the days are evil. You know, we can even quote it. God says we should redeem the time. And we are so busy redeeming the time that when we turn. You know, I had a life-changing conversation with a retired judge just a few weeks ago. This woman retired in November also. And presently, she is dealing with chronic kidney disease and is surviving on dialysis. And she got depressed. So I got to talk with her and was trying to review, what are your hobbies, ma? She said, I never had hobbies. I spent all my life, she said, I'm either reviewing cases or writing cases. You know, so and the time, at the point that she was retiring, she cannot even take the rest. Why? Because the body has given way. I believe that if she had paid attention to herself, perhaps she would not be in this state. And that is what a lot of us that are active are doing. We feel we are undeserving of rest. We are almost Jesus Christ. Everything is like, if I am not there, the world will stop. But you know, I have learned that there is nobody that is indispensable. That's your role, whether it's in church, in your family, wherever it is. The day you fall down and die, somebody will fit into that role, perhaps even better than you used to do it. So we should not look at ourselves as undeserving. So let's quickly look at holistic rest. I want to look at it in different aspects. We will rest our bodies, rest our hearts, rest our souls, rest our spirits, rest our senses. I just want to give you a few tips to which you can do that. So the first, rest our bodies. And for all of us, when our bodies are going through stress, we respond to it differently. There are people that will have aches. There are people that will just be tense. There are some people that when they get stressed, they go into tremors. There are some people that when they are stressed, their eyes become red. So we all respond, our bodies respond to stress differently. But the point here is that I don't want it to be that it is only when we are stressed that we rest. But that if we can create margins in our daily life to rest our systems, to rest our bodies, to rest our souls, to rest our spirits, then we prevent ourselves from getting to the stage of fatigue. So how can we rest our bodies? Baths are wonderful. And if you are somebody like me that don't like water, I bath because of hygiene, not because I enjoy bathing. That's just the truth. Some of us don't like water. But baths can be refreshing. Warm baths can rest our tired bodies. So when you're tired, after a time of work, when you are feeling not so coordinated, take a bath. It might make a difference. Gentle movements for those that sit for a long time. Whether you're in your office, you are in your homes, working on your systems. These days, you know, we do a lot of sedentary kind of lifestyle because life is so comfortable. You enter your car, you go and park at the nearest parking lot to the entrance that you want to go. You know, if we are going to Onibinde, for example, we are looking at the closest spot to the entrance of Onibinde, so that as we are jumping out of our cars, we are entering Onibinde. In fact, if there was elevators in Onibinde, I'm sure some of us will use it to go up and to come down. So we are very sedentary. If we want to rest our systems, after a period of sitting, after a period of lying for so long, let's move our bodies gently. Moving different parts of our bodies, whether it's our jaws, our necks, you know, our hands. For those of us that work long on computers, get small soft balls by your decks so that after a while you hold them and you move your fingers. You roll them under your feet, so that you move your joints. They are very important for resting our bodies. Deep breathing exercise is also very important. And the interesting thing about deep breathing exercises is that you can do them even in church. You can do them while you're having meetings and nobody would even know that you're trying to relax. How do you do deep breathing exercises? You take in a deep breath until, you reach the maximum. Hold it for 20 seconds, 30 seconds. So you count. 1, 2, 3, 4, 5, 6, 7, 8, 9, up to 30. Then you release. Count up to 30. Take another deep breath. Do it maybe 5 to 10 times, depending on how it can relax the body. Another thing you could do is progressive muscle relaxation. It's not on the slide, where you tense the muscles. You can start from your feet or from your neck. You tense the muscles, count up to 30, relax them, count up to 30, tense, you keep doing that for some cycles and you feel relaxed. That has been helpful even for anxiety. When you find yourself in a state of panic, maybe you have received bad news and your body goes into fight or flight mode, you do that, you feel yourself relaxing. Then being still, just being on your bed. I hope you know that sleep and rest, they are two different things. We're not talking about sleep today, we're talking about rest. Just being still can help to relax your body. I want us every day to ask ourselves, maybe at the end of the day, when we come back home, let's make it a practice to ask ourselves, how does my body feel after today? When you are about to go to bed, ask yourself, how does my body feel after today? Am I feeling tense? Am I having some pains and aches all over the place? Do I need to gently move my body or practice stillness? If you are the person that has been all over the place, at the end of the day, just be still for a while before you go to bed. If you're a person that has been in one position for too long, then move parts of your bodies before you go to bed. Very important. So let's quickly talk about resting our minds. That is what we don't pay attention to as individuals. It's easier to rest the body than it is to rest the mind. Because you can be on the bed, you can be and then your mind is all over the place. You might be sleeping and you're calculating the price of sugar in your head. So things happened like that. Resting our minds involve moving our minds from concentrating on the outside world towards an inward focused thinking and feeling. So you're not thinking about the prices of things. You're not thinking about how GAD is not giving us light. You're not thinking about the problems of Nigeria. But you're now trying to bring yourself inwards to focus on what you are feeling or to dealing with what you're feeling or how to deal with the emotions that are going on in your mind. What are some of the things that can help to calm our minds? We can help our minds, we can rest our minds by getting engrossed in a good book or a TV show. Now, good book is not professional books. Good books is not news of Nigeria, because news of Nigeria can make you more tired than you were. Good books must not necessarily be the Bible, because when you are reading the Bible, if you truly want to benefit, you are reflecting, you're engaging, you're walking. But a good book that will relax your mind would be more of maybe a fiction, maybe a story, maybe history, something for people that love history. Those are things that could relax your mind. A TV show that is not so violent, not too stimulating, can also help to relax your mind. Hobbies can relax your mind. He talked a lot about hobbies earlier on, whether it's knitting, gardening, photography, taking a walk, whatever kind of hobbies you enjoy doing can relax your mind. High intensity activities. So aerobic exercise. Exercise is not just for weight loss. Research has shown that when we engage in high-intensity exercise, there are chemicals that are released in our brains that enhances our well-being, that promotes our sense of satisfaction, that promotes the sense of our enjoyment of life, that relaxes us, that reduces pain, whatever pain we might be having. So high-intensity exercises like a good jog, like a good, vigorous dance can help to actually relax our mind. One thing I know about aerobics is that you cannot follow an aerobic routine and be thinking about things. Because if you're following an aerobic routine and you're thinking about things here and there, you're more likely to make mistakes. So it takes your mind off the issues for a while, and then it gives your mind the ability to settle. And when your mind is a little bit more settled, then you can concentrate, you can focus, and you can solve problems better. Then the act of mindfulness also helps us a lot. One of the problems that we have, adults or children, young or old, is that we lack the ability to be mindful. What is mindfulness? Mindfulness is simply focusing on the here and now. A lot of us are living in the past. A lot of us are living in future that will never come. Your child is in SS1 and you're thinking about WAEC fees when you have not finished paying third term school fees of SS1. That is the way that is what gives us anxiety. That is what gives us depression. The act of mindfulness is to try and bring my mind to the present. What is happening now? What am I feeling now? What is responsible for the way I am feeling now? What can I do now to help me navigate what I am going through now? Not what I am going to go through tomorrow. Not even what I am going to go through in the next 1 hour. That is mindfulness. So practicing mindfulness helps to filter out a lot of issues. And it can help to relax our minds. Questions that we need to ask ourselves on a daily basis. What time of the day do I need more mental rest? Ask yourself and answer it for yourself. Some people, the morning hours, very early, maybe after their quiet time, they meditate a bit. Some people it might be nicer and easier for them in the evenings when they come back. It might even be in between work. But ask yourself, what time of the day do you need more mental rest? Give time and have that rest. How do I need to rest my mind today? Ask yourself. It might be through mindfulness if you have found your mind wandering all over the place. It might be get that novel that you used to read, used to enjoy reading, and go through it again. It might be sit in front of a documentary and just relax for an hour without feeling guilty about it. It might help you. So let's go to the next. How do we rest our hearts? And our hearts here is not, I'm not talking about the heart muscles that pump, as Pantong said, 3 weeks after from 3 weeks after we are conceived to when we die. But I am talking about our emotions. How do we rest our emotions? And I tell you, a lot of us are going through hurts that happened to us 20 years ago we have not let go. A lot of us are 20 years in marriage. We're still angry about what happened on our wedding day, what that uncle said or did not say, and we have not forgiven them. We don't even know that they are raging in our subconscious until the day we get depressed and you're talking with a therapist, a counselor, and they are bringing it up to you. A lot of us are angry at our children for the offense they committed 3 years ago. A lot of us are angry with our husbands and our wives for something they did, and it's stopping us from moving forward. So how do we rest our hearts of emotions? I think the first I would say is do not numb your emotions. One of the things that Christians are very good at doing is numbing our emotions. We spiritualize everything. We stop ourselves from feeling the anger we feel. We stop ourselves feeling the unforgiveness we feel. We confess things that we do not experience. And we don't talk about them. And for us, some of the Christians, again, we are experts in making people feel that if they express their emotions or if they talk about their emotions, that means they are not spiritual. But part of resting our emotions will demand that we do not numb our emotions. We could numb our emotions with alcohol. He talked about it, and we are debating whether we should take it, whether it's for our stomach or for our hearts or for whatever it is. But the truth of the matter is alcohol numbs your emotions. It does not give you the time to process the emotions, to feel the emotions, for you to be able to heal whatever kind of emotions you are going through, whether it's sadness, grief, loneliness, anger, unforgiveness. You need to feel the emotions. So we need to give ourselves permission to feel emotions instead of numbing them. Don't numb them with chocolates or ice cream. Don't numb them with scripture. Scripture is good. I believe in the scripture. I confess the scripture, but I don't hide under scripture to deny what is going on in my mind. The next thing that will be helpful is to talk to someone. We need to learn to talk. A lot of the times that we break down mentally is because we are trying to process things by ourselves. And then we find ourselves breaking down. And church, I plead with you, make yourself worthy of someone coming to talk to and feeling safe. Create safe spaces where people can talk without fear that they would be given as examples on the pulpit or in prayer requests, and things like that. We need to create safe spaces. And then when people talk, they don't feel judged. And you know that a lot of times we judge not by our words, but by our body language, by the way we look at them, by the way we appear disgusted when they are talking about the things that bother them. So we need to create safe spaces so that people can talk. We also need to talk. Galatians 6, to bear one another's burden. By so doing, you fulfill the law of Christ. So allow people to bear your burden as you bear other people's burden. Talk. It rests our hearts. It rests our emotions. Journaling has been found to help for those that like to write, but for me, I don't like writing, so I don't journal. But if you're somebody that loves to journal, write down your emotions. It helps in making the heart lighter. So you might want to write. Some people will write. In fact, I have seen people that say they feel better when they write, they pray about it, they tear, and then throw away. It gives them some relief. So if you're that kind of a person, please go ahead and do that. But let's also learn to rest our hearts. Remember, resting is not about sleeping. It's not just about resting our bodies, but we need to rest our minds. We need to rest our hearts or our emotions. So what questions do we ask ourselves? How truly do I feel? When, for example, I snap at my husband because he scattered his shoes, if I sit down and I am mindful, I can ask myself, how truly do I feel about this? And why do I feel like this? Why did I react like this? You might discover that the reaction to these shoes has nothing to do with the shoes, but the fact that he didn't buy you fish last week. That is how the human mind works. And until we pay attention to it, we never really would solve the real issues. A lot of times when people come for counseling and they are fighting, she does not do this, she does not dress well, she does not put this, he did this, he doesn't do that. The real issues are what happened 5 years ago. And until we introspect to ask ourselves, how do we truly feel? We might not be able to deal with the emotions. What has been the challenge? How did it make me feel? So he said this, and I felt this way. And we are honest with ourselves, then we can deal with the emotion. Do I want to rest my heart by internal or external processing? Internal processing is just what I described. How do I feel? And things like that. External processing will mean you go out, to maybe you go out for a walk or you go out and talk to people, and things like that. But a lot of times, you need both. And when you settle what is inside and then you do something external, you're more likely to heal. So let's learn to ask ourselves these questions. Quickly, let's look at resting our souls. Our souls is beyond what we see, what we feel, is beyond our emotion. That is what we refer in Christianity as the inner man. Is it possible to rest our inner man? Very possible. When our souls is exhausted, we can lose our sense of purpose. Remember, mental health requires that you maximize your potential. If you lose your sense of purpose, you are not able to maximize your potential. You need to find a safe space to ask questions and concerns. Questions would come in life. It's not wrong to ask questions. Almost every powerful man of God asked questions in the Bible. Elijah asked questions. Job asked questions. David asked questions. People asked questions. Sometimes we might find the answers we need. Sometimes we would never find the answers on this side of eternity. But it's important for our souls to have rest, to find a safe space. And the safest place that we can find to ask questions is with God. Matthew chapter 11, verse 28 to 30 says, "Come to me, all who labor and are heavy laden, and I will give you rest." Then it went to talk about how we can get the rest. The Message translation will say, "Walk with me and walk with me." And you would find rest and refreshing and comfort and ease for your souls. Prayer also helps to rest our souls. And it's not the kind of prayer that, we like praying in church. Oh God of Abraham, Isaac, Jacob, the maker of the mountains and the maker of everywhere and the beginning and the end, the first and the last. Those are not mind-resting prayer. Prayer that will rest our souls demands that we are honest with God. That I can come before God and say, "God, I am honestly angry. Father, I do not want to forgive my husband." And I've said those kind of prayers. I truly don't want to forgive this man, but you have said that I should forgive him. And I really feel like you should punish him right now. But okay, let's see how this goes. And I have prayed prayers like, "God, so you're giving people miracles and it is me that you have decided that you will not give this miracle to." Okay. Those kind of prayers from the depth of your soul, that you're able to express your heart, that you're sincere, that you cry before your God, that you anguish, you groan. In fact, the kind of prayers that probably you cannot express by words, those kind of prayers that the Holy Spirit will take and translate for you. Those are the kind of prayers that gives us rest. So the next time you feel weary, the next time you feel tired, can you just be honest with God? Praise also helps to rest our souls. I don't know if you're like me and you love music. There is something that music does to the soul, that it can help you feel light. It can help to refresh you. Gratitude, no matter how your life is going, there is always something to be grateful for. If you have a cancer diagnosis and you sit down and look at it, for the fact that you got the diagnosis is something to be grateful for, because there are some people that will have cancer and nobody will find that cancer until it comes to kill them. So there is always something to be grateful for. That you're here today is something to be grateful for, even though you don't have a job. That you have children that are giving you tough time. Remember that there was a time you were crying for the children and you got them. Is something to be grateful for. Gratitude might not make our problems to disappear, but it changes our perception. And one of the things that I say everywhere I go to is that whatever is happening to you is not as important as the interpretation you give what is happening to you. So gratitude changes our perspectives. Connecting with nature can also help to rest our souls. The Bible says that God's nature is seen in the things that he has created. So for my friend Pantong that likes going to snap beds and looking at the colors and looking at their legs and the beaks and the whatever, it's something that if you can just connect it with the awesomeness, the sovereignty of God, you will find rest for your souls even in nature. Questions to ask ourselves. Do I wake up with a sense of drive or purpose? When I wake up in the morning, how do I feel? Do I feel driven? Is there something I am set to achieve? Or I am the kind of person that wakes up randomly and it is whatever the Lord, pleases, let's do. It's good, whatever the Lord pleases. But God has created us with purpose. So when you wake up in the morning, do you have a sense of drive or purpose? If not, your soul might be weary. You might need to rest your soul. Am I going through a big life shift? Are you going through menopause? Are you going through marital crisis? Are you going through transition from secondary school to university? Are you in between jobs? Did you just get a promotion? Did I just get a health diagnosis? Am I going through a big life shift? If I am going through any big life shift, whether it is physical, mental, spiritual, it will be good for me to pay attention to my soul. What am I grateful for today? You know, people do gratitude journal. It's one of the things that I don't know. Maybe I should be typing it. I don't like to write. I just don't like writing. So, but if you can keep a gratitude journal, honestly, it transforms lives. I have heard people talk about how just waking up in the morning, writing 5 things I'm grateful for. Tomorrow I write 5 things I'm grateful for. Changes your perspective. Very important. The next thing I want to talk about is resting our connectivity. We are coming to a close. Resting our connectivity. Our connectivity is our relationships with people. My relationship with my husband, my relationship with my children, my relationship with my friends, my relationship with my co-workers. A lot of us are so busy everywhere, talking to everyone, counseling people, praying with people, that we don't have time to connect with ourselves. This is something that we need to practice doing. Find time to connect with yourself. Give yourself time. Create me time. You need time alone. You need time to touch base with who you are. So, mothers, even if your children are all under the age of 5, find some time and give them to house help or give them to daddy. Close yourself in one room. Have some alone time with yourself. Very important. Have some times that you would be quiet. Very important. But again, there should be time that we plan to connect with people that energize us. There are people that I just love to talk to. When you talk to them, there is a way they just encourage you and spoil you. Find time to connect with those people, whether it's weekly, once in 2 weeks. Just find time to connect with people. Find time to meet up with friends, but don't drink or sit down and talk. Talk about Arsenal, talk about Man U, talk about all the things, talk about Weavons and whatever. Just find time to connect. It's very important. If you're going through menopause, find other people, menopause people like you. Talk about hot flushes. Talk about, just connect with people and come out energized. It's very important. What are the questions we need to ask ourselves? Do I feel tired? Sorry for the spelling. Or irritable with those around me? When you begin to find out that your husband is irritating you, honestly, just give him some space for a while. Recharge and come back. The relationship would be better. If you feel overwhelmed with your children, with your whatever, just create time. Be away. It can work magic. A lot of times you don't need to even sit down and be praying about every single small problem. Just take care of yourself. You discover that the problems will disappear and the things that are real issues will stand out. Am I craving some alone time? Don't be guilty. Take it. How much time do I spend with the people that refresh me versus the people that drain me? You know that there are people that can be very draining. Those ones that when you sit with them all the time, they are talking about how Nigeria will never be better, how Plateau State is so horrible, how it's better to go abroad, how those of us here are doomed, how is the end times and 666 is coming. They never tend to talk about anything positive. You need to limit your time with those people and spend time more with people that energize you. Resting our connectivity requires us being honest with ourselves and being honest with those around us. Talk to your husband. I need some time alone. If you can afford it and you need to get away, and please, fathers, if your wife says, I want to go out with my friends for a weekend, it should not be all the time. Well, let's not abandon our houses. But once in a while, go away. Sit with your friends. If possible, 1 or 2 days. Talk, pray, laugh, recharge, and come back. You will be better wives. You will be better husbands. It's very important. Resting our senses, our hearing, our eyes, our smell, our skin, very important. Because sometimes we can be overloaded. And we are living in a time of sensory overload. The TV is there, our phones is there, the computer is there, noise is everywhere, everybody is shouting at one another. We cannot drive without blasting horns. You know, sometimes you're on a go slow and somebody behind you is just doing pim, 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 and you're wondering, come and fly now. You know, it's like they just want you to clear off the road. So noise is everywhere. How do we rest this overstimulation? We need to, sorry, my slides. We need to rest our eyes. We need to rest our eyes. And, sorry, I think my slides were, a slide was removed, but we need to rest our eyes. And resting our eyes would mean that when we are away, when we are working on the screen, take your time to go out. Research has shown that when you're somebody that works so much with computers, just going out and utilizing your long vision can help to rest your eyes. So if you're at home, you're doing a lot of work, you're doing research, you're doing whatever, just go stand out, look ahead to the mountains, look to the skies, look up to the trees. It can help to rest your senses. Very important. We need to also rest our sense of smell. Nice scents around your houses. Invest in, they must not be too expensive. If you like candles, make a ritual of, if you're taking your bath, light scented candles. Have very good sense of smell around you. It will help to rest, you know, your olfactory system. That's your nose. Fresh air, very important. Our houses, plant trees, plant whatever, step out. Just take a breath of fresh air. It can help to relax your sense of smell. Rest your ears after especially if you walk in places that are very noisy, terminus, and what are the other places that are very noisy, or you walk with children and they are shouting, yes, ma, yes, ma, yes, ma, all over the place. You come back home, try to rest your ears. And you rest your ears by unplugging from sources of noise. You can use earbuds for some time just to get some kind of stillness in your ears. Very important. Resting our skins, important. You hydrate, he talked about it. Massage, very important. And you know, massage must not be in the massage parlor. We can massage ourselves. It can help us to relax. And so we need to do all of that. I've talked about so many things. The question is it possible as we bring this to a close? Is it possible? It is very possible. You might ask, why am I saying rest this? Then him is saying diet, work out, exercise. You know, it seems so much. How do we practically bring all of these things together? We do it by making them achievable. So we need to create rhythms. We need to create rhythms. Create daily rhythms, create weekly rhythms, create monthly rhythms, create yearly rhythms. Very important. Daily rhythms, link them up with some things that you do. For me, if I wake up early in the morning, the first thing I do is I pray. I take a cup of coffee. I sit for like 5 minutes on the dining table doing nothing. Then I am in the kitchen. At that time, while I am taking my coffee, I can light a scented candle. I have relaxed. I have rested my smell. Or when I go to bed, as I'm trying to meditate, I put some earplugs. I'm resting my ears. I'm meditating. So we create a ritual or a rhythm that works for us every day. Why? Research has shown that when we do things as a form of ritual, it opens up neural pathways. That it opens up pathways in our brains that helps make it more enjoyable and make it more that it will become a habit. So don't just wait. Pick something that I said today. Attach it to a daily ritual of your life. And then you will find out that with time, it becomes a part of you. Very important. Let us have, weekly rhythms. You can say every weekend on so days. For me, every Sunday afternoon is my rest time. So I am on my bed. I do whatever I want to do. A lot of times I wash my face. and I put on facial masks for like 15, 20 minutes. And when I remove it, it's very hydrating. And it helps me feel relaxed. So that is a weekly routine that I have. You can decide once every month we go out and we sit and we eat, or we go out, take a walk in the park. Every year we do this. For me, in my house, every year we don't do Christmas at home. We go somewhere where we don't have to cook or whatever, and we rest for those days. It's a yearly rhythm. And so we plan towards it every year. It can help us to inculcate all of these things. We need to have anchor points, and we communicate it with people around us so that they know. You know, I had some time off with a few friends in March. Since November, I started talking to my husband. We want to do this. We want to have a girls' time out. You know, so his mind was prepared. When it was it was January. When it was January and it was time to go, there were no issues because I had communicated it earlier. So whatever it is that we want to do, communicate it with your children. Let them know that Sunday afternoons are mommy's resting time. I don't want disturbance at this time. Very important. So as we conclude, I would want to challenge us with the principle of the Sabbath. We talked about it earlier on. Remember the anchor word for Sabbath, which is Shabbat. It means to cease, to be still. When the instruction was given, it was 1 day out of 7 days. And that is about 14% of the week was to be dedicated to rest. So can I challenge you? 14% is 1 day in a week. And if we look at it and we try to take 14% of the day, that will be about 2 hours in a day. Can you dedicate it? And if we are awake for 18 hours, taking 2 hours out of 18 hours to get some form of rest is not too much. It's going to refresh you. It's going to re-energize you. It's going to make you to fulfill that thing that God has created you for better. So can I begin to challenge you that in each day, you get about 2 hours that you just rest. You can take it in chunks of 30 minutes. You can take it in chunks of 15 minutes. But ensure that you're bringing that Sabbath margin to your life. That I am resting my senses, I'm resting my spirit, I'm resting my emotions. Break it down. Incorporate it to the routines of your life. But try to get that 14% of your time of being awake in a day to bring it to a point that it will help you rest. And I think when I tried to bring it to a month, I got about 4 days in my Sabbath calculation. So if we look at Sabbath beyond just coming to worship, if we apply the Sabbath principles to our daily life, this is doable. I conclude by reading something that someone wrote that is I found it to be very true. It says, rest is not something the world gives us. Nobody is going to give you time to rest. It has never been a gift. It has never been something you do when you have finished everything else. If you want to rest, you need to take it. You have to resist the deceit of busyness. Make time for rest. Take it seriously and protect it from the world that is intent in stealing it. And you would agree with me that the world is intent on stealing our rest. If you don't believe me, look at what your phones are doing to you. You go to bed instead of sleeping. You're moving from WhatsApp to Facebook to Instagram to whatever it is. And before you realize it, 2 hours of your sleep time is gone. The world wants you not to rest, but you can take it back. Praise the Lord.
Can we give her a big round of applause? A big, big round of applause. We're going to take questions. Some papers have gone out, so you can submit them. But if you want to ask your questions, I can get the mic across to you. We're very privileged to have her. She's also the Deputy CMAC administration in youth, so you can understand how busy she tends to get. So I've seen one hand there. One here. Okay, can I see all the hands? All right, so I'm going to give numbers for the hands. Okay. So you'll be 1, 2. I saw one behind there. 3. There was one here. Okay, 4. Okay. We'll take all the questions and block, then should speak to them.
Good afternoon, church. It is interesting that the topic of this discussion is mental health. More interesting is the fact that it talks about mental rest. May I ask, ma'am, in mental health, is there anything such as psychosomatism? If it is, if there is, what does it mean to be psychosomatic? That is question number 2. Then number 3, what are the symptoms that one should look out for when one is psychosomatic?
What was number 2?
Just 2 questions. 1, I heard a statement, rest is in the mind. To what extent is that true? Secondly, what contribution does our physical environment do to the whole area of resting? Especially in your room, the color, all that kind of stuff.
Thank you, Ma, for the enlightening presentation. Some people say that they use their phones, go through social media as a form of rest. How do we correlate that with the teaching? And secondly, there are some form of people that you mentioned that give negative vibes. What if they are close family that you can't do away with? How do you handle that?
Okay, my first question is there any time that when you rest, any time of the day, that when you rest is most effective? Is there any time? Number 2 is a personal challenge. Maybe you could help out. Before now, I thought to me, sleep was a gift because I can sleep anywhere at any time. Yes, so all I need to do is to close my eyes and off I go. But after my surgery, I discovered that sleep becomes a problem. I do all I can. In fact, like last night, I slept around 3 a.m. I don't need to hold my phones. I don't need to do anything, but sleep, becomes very difficult for me. Probably because of pains or probably because I just can't sleep. And I'm not the drug type. I don't like taking drugs to sleep. So how do you think I can get back to that, my gift of sleeping? Thank you.
That's not fair. Okay, thank you very much for your interesting questions. At least it showed that I was not too boring. I was worried about how I was going to make this presentation today. So thank you for that. A lot of people seem to be having challenges with believing that the mind can be rested. I've seen several questions here. Rest in the mind, to what extent is this true? Another person has asked it, and several. So there is a concern with that. Yes, it is difficult, but it is possible. It is difficult, but it is possible. It takes practice, but it is doable. The true man is beyond this. It's usually what goes on inside. And what goes on inside us has to do a lot with our minds. That is our brains. And you don't need to make effort for things to keep popping up. if you have been the kind of person that your mind works all the time, it's going to take time. But you would need to learn, the act of mind. I talked about mindfulness is a whole story on its own. There are techniques and stuff. But if you want to practice the rest that comes from the mind, it has to start from mindfulness. Bringing yourself to think about what is actually going on in my mind at this point. Why do I feel like this? And trying to bring yourself from yesterday, from tomorrow, and bring yourself from today to today. When you start, you would find your mind wandering. It's just like focusing on the scripture. I'm sure the habit of meditating on the scripture, it took discipline. It's the same way. If you want to rest your mind, it takes a lot of discipline. So you would start, just like we read when we are doing our quiet times. Then the thought of the market will come in, the thought of school fees will come in, the thought of that your boss that was annoying would come in. But you would now learn to keep struggling and taking it away and going back to the scripture, taking it away, going back to the scripture, until a time comes that you discover you're doing it more effortlessly. That is discipline, that is training. So you can actually train your mind, and then time will not permit me to talk about all the processes that you can do that. But it is possible that a storm can be raging in your life, and your mind would be very calm if you are able to learn mindfulness, learn the act of being still. I don't know how I would do it, but if I find some very simple materials on that, maybe I would share it through Dr. Ferdinand so that you can, but it's possible. It's possible. It's possible that you might not have paid school fees and you can still be peaceful, because it starts with, in fact, appraising the situation in your head. If you don't have school fees, you don't have school fees. If you train yourself to know that thinking about school fees from now till next tomorrow will actually not bring the school fees, or worrying about school fees does not bring school fees. If you learn that problems are in two dimensions, the one that you can do something about and the one that you cannot do anything about, and I ask myself, what can I do about it? If there is something to be done, I stand up and do. If there is nothing to be done, I pray about it and continue my life. Then gradually, you will learn the act of being still. Then, how does our environment contribute to rest? Very important. Our environments can be stressful. If you're like me, I like tidy environments. If I enter my kitchen, and somehow, will I say fortunately or unfortunately, I have boys in the house. So I have a boy who is cooking. And you know what it means when a teenager cooks. My boy cooks very well. But when he cooks, from the cupboard up to the front of the kitchen, the door that goes outside and the one that links to the sitting room, there will be things tumbling everywhere. Once I enter the kitchen and it is like that, honestly, my mind goes, it stresses me out. So the environment, the same thing, if your room is very dirty, haphazard, whatever, it might not allow you to relax well. If you have good aesthetics, you have trees around your house, flower, whatever it is, when you come outside, naturally, it is easier for your body to take the posture of rest than when things are scattered all over the place. If you're living in an environment where there is grinding machine here, there is generator here, there is whatever here, even when you're on your bed, it's difficult. So yes, our environment. Or you have, when they say, in mental health, having 3 or more children under the age of 11 is a risk factor for depression. Why is that? Because this one is reporting this one is peeing, this one is jumping, this one's kata is running. Everywhere is just a ball of mess. And so it heightens your sense of, it overstimulates your ears, and then what you're seeing too is not too pleasant, and you're more likely to get stressed. So yes, when we make our environment nice, our environment comfortable. I'm sure there are houses. There was somebody that came to my house one time. I had put some scent and whatever, and he just came and said, Kai, this your sitting room is so relaxing. It was from what he was perceiving. So our environment can help us to rest. Psychosomatic, what does psychosomatic mean? Yes, psychosomatic is also another very big topic, so I will not be able to do justice to it now. But when we say something is psychosomatic, we just mean that one has psychological distress that is being converted to physical symptoms. That's just the meaning of psychosomatic anything. So you would hear psychosomatic disorders, psychosomatic illnesses. It just means that there is psychological distress. The body, because of the fact that we are not so psychologically minded, so it's easier for us to bind and cast sadness. It's easier for us to confess, the joy of the Lord is my strength. Meanwhile, I am depressed. So the mind has to find an outlet so that you can help the mind. So you now start having back pain, headache, abdominal pain. Sometimes you would be having dyspepsia, so you will be disturbing Dr. DAVWAR all over the place. They will do endoscopy. And let him, if he was to tell you, more than half of the endoscopies they do are negative. As in no ulcer, nothing. And like 90% of those things, in fact, we would go, let's do a study so that we'll tell them the real figure in our environment. But I am sure if we do that study, you will discover that 90% of the negative endoscopies are psychosomatic. People are just stressed. So when you are stressed, that your psychological distress can set up a lot of things in your body. It will increase your gastric secretion, and then you begin to have heartburn, and then you think you have ulcer. That is psychosomatic. And people you're asking for symptoms. Every possible thing that you can think about can present as a result of psychosomatic illness. So you can have headache, backache, abdominal pain. In fact, it can present as if you're dying. You would think it's a heart attack. And I have seen people that have been taken to ICU because of psychological distress. Your body just goes into a state of panic. Psychosomatic, it can lead to even infertility. I'm sure she talked about sexual issues, erectile dysfunction, infertility. All of those things can be psychosomatic. So I hope that we have, with these few sentences, I've given you an idea of what psychosomatic means and what are some of the psychosomatic illnesses. And if you are the kind of person that you are having complaints and you go to the hospital, they do tests, they didn't find anything. Tomorrow you move from that hospital, it's because that hospital, they don't have experts. You move to the next one, they didn't find anything. Yet your back is paining you, your neck is paining you. It's most likely that you're having psychosomatic issues. In fact, we're seeing it a lot. Our neurosurgeons and our neurologists are beginning to see that a lot of the back pains that they deal with is actually psychosomatic. And a lot of times when you come and you handle their depression, you handle their anxiety, you handle their marital issues. Marital issues is one of the commonest causes of backache. They get better. So that is psychosomatic. Social media and as rest. The truth of the matter is social media is very stressful. It's more stressful than resting. It's actually more stressful than resting. And it is one of those things that is addictive. That is the problem with social media. It does what alcohol does to the brain. Similar thing. Not in this sense of chemically killing the brain, but the kind of chemicals that are secreted and how it can lead to addiction. And then it overloads our senses. It overloads the eyes, it overloads the ears. If you have to listen, a lot of times, these kids people, they have found a way of making 30-second skits or 2 minutes, not more than 2 minute skits, and just put it everywhere. By the time you're listening to it, you don't realize this. You wake up and you have spent 2 hours just listening to nonsense comedy that makes sense or does not make sense. And then you now discovered you have wasted time. Then you are more stressed trying to meet the next deadline. And then you end up more stressed than you have rested. So social media is something that I want to be careful with. In fact, most research will tell you to keep off social media if you want to rest. So let's not make the habit of social media as a way of rest. Instead, we should count it as one of the things we actually avoid when we want to rest. It's very helpful if we take times away from phones, in a day. Decide that I will not touch my phone after 7 p.m., for example. I'm not giving you time. Or I will not put my phone on weekends. But if you're a doctor, you can't do this, so there can be emergencies. But then you can say, I would put off my data till 12 noon so that you don't do social media. It's very important. In fact, that has been correlated with all aspects of health: physical, mental, social well-being. For people that give you negative vibes and they are your family members, God help you if your wife or your husband is the person giving you negative vibes. What do you do? What has been found to be helpful is, yes, you can create some me time. Generally, even if your husband is giving you positive vibes, create me time. It's not okay that because of you love a person, you're one, but you're also whole human beings that need to recharge yourself so that you can be the best partner to your spouse. But if a person is consistent, if he's a friend, it's easier to say, okay, I don't need to have anything to do with this person. But if it is somebody that is in close proximity, your child, your whatever, what you need to do is create some space between you between the two of you for some period, where you're able to reflect, process, recharge, so that you can handle the person's stuff better. So you create some temporary separation or gap so that you can just have some rest. Because whoever the person is, it can be draining. And that is why even if sometimes you can have challenging situations like a person with dementia. If you're the same person handling the person every day, the chances that you will abuse the person is higher. But if you're taking turns, you recharge and then you're more likely to handle the person better. So what you need is temporary time to just be alone, recharge, and move on. Is there any time best for rest? Rest, remember, is different from sleep. If it is sleep, daytime sleep cannot replace nighttime sleep. There are some things that happen at night when you sleep. There are some hormones that get secreted only at night. So you get the full benefits of sleep at night. So the benefits that you get from sleeping during the day is different from what you get at night. That one is different. But for rest, anything that works for you, morning, afternoon, evening, best to do is to even spread it. You get some relaxation time, even if it is 5 minutes early in the morning. As you walk during the day, in between, you catch some rest, in between meetings, in between reports. In the evening, any time of the day, you can rest. The person with sleep problem after surgery, I think you would need to see a doctor for that. A lot of things can disrupt sleep. And if it is getting persistent, then I will need more information than what you just said to help you. How do I rest without going to the office when I have uncompleted deadline work to submit? How about school fees and debt? Let me talk about your office and your deadlines. These things are true. As I speak with you, I'm hardly home before 6 these days, and I leave early in the morning before 8 o'clock, and there is so much to do. But I have learned that when I am reaching my wit's end, when I am beginning to feel some kind of way, I am honest with my colleagues. And everybody knows that I'm not a lazy person. So when I say I cannot do today, everybody understands. And that is because I have seen that me like this, I am not indispensable to the survival of Jute. In fact, I'm very minute, very tiny in the whole of Jute for anything to stop because of me. But most of the times we believe that if we don't do, nobody else can do. If we rest, the world would end. The world will not end if you go and take that sleep. And the interesting thing about rest is that if you have deadlines and you give yourself time to sleep and you wake up maybe 1 hour or 2 hours earlier, Do you know that within that 1-2 hours, you will accomplish what you would have spent the last 6 hours doing? Because you will be making a lot of mistakes. You will have to redo. You have to. Because your brain will not be able to coordinate better. So rest regardless of your. In fact, it will help you to meet the deadlines better. You have office work, but you have weekends. But you have after office hours. Can you leave the office work in the office so that when you come home, you are resting? There are office hours for a reason. So we need to do that for ourselves. School fees and debt. Yes, they are there. We might not be able to do anything about it. But for debt, I think people can do something about it too. One of the things, for us that are doing suicide prevention work, one of the things that is killing people is loan app. People take loan app things and then it stresses them, it makes them suicidal and whatever it is. And I tell people, even if you're dying, avoid loan apps. That is one of the things. But ordinary debts, talk to people about it. Don't be ashamed to ask for help. As long as you're not a compulsive, there are compulsive debtors that even if they come, I will not give them anything. But if you're not a compulsive debtor and for some reason you find yourself in debt, what is the importance of Galatians chapter 6 verse 2? Why are you in a church? You cannot talk about it. You cannot ask for help. Ask for help. Do what you can do to pay off the debt and then live your life. You cannot pay school fees. Do what you can do. The one that you cannot do, that is it. That is just life. And no matter how hard you worry about it, I repeat, it will not provide the thing for you. Rather, it will make you sick, and it will make it less likely that you would be able to get that school fees. Because the 30,000 naira you gathered, you use 15,000 naira to buy treatment. So let's try to see the futility of worry. That's why the Bible commands it. Whether you worry or not, it will not change God, but it will change your own outcomes. So let's learn to rest despite the challenges that we have. Thank you very much.
Thank you so much, ma. A bigger round of applause for her. It's been a very interesting and exciting time. Quickly, we will move to the next session. Some young men came to do some sports this morning here, and while they rounded up and were on their way, the bloodhounds that were ready for blood donation accosted them, and we've started the blood donation already under the tree there, and some of the young men went to donate. So that is one of the things we're going to be doing after now. For those of you that came ready to donate blood, we're ready for you. Have no fears. If you are not sure whether you can donate or not, you will just walk to where they are and ask them the requirement.